Hey Sue, this is Sue Jacobs. Thank you for your informative YouTube videos. Thank you, Sue. Appreciate that. I feel I should buy your Heal Everything tea, but am writing to check that this is what you would recommend. My husband has penile pain. Where are these coming from? My husband has penile pain and throbbing ever since his resection of prostate operation 3 years ago. Oh my God. See, this is the problem when you get into these surgeries and you get into these things. Some of the side effects ain't so good. Well, that's right, Granny. I can't say ain't. Well, okay, so you know, first of all, to have a resection or anything done to the prostate, you talking about prostatitis or prostate cancer, obviously. So this is a lot of acidosis, but it's everywhere. It's in his testicles, it's everywhere. You want to pull him out of pain, you got to get him out of acidosis. To get him out of acidosis, you got to get him away from proteins and all things that are acidic forming. That's your grains, your beans, your meats. You want to get him up on and fix. You got to go back and fix your man from the beginning the right way, the way he should have fixed this prostate problem. But because he chose to treat the symptom, now he's got another symptom, worse. It's just a nightmare from hell. And the fact that he can develop scar tissue can make some kind of pain like, so his only hope, unless it's scar tissue the surgeon can go in and cut out, but then it just makes more. Because when you do surgeries on weakened, highly acidic areas, it scars. So you want to do surgery, the last thing you do. You want to try to fix it first. Now, the kidneys and adrenal glands are your main issues here. So you want to get into his kidneys, get them filtering, his adrenal glands, and you want to get him alkalized and pull all this acid out of his prostate. And if there's scar tissue from the surgery, you're going to have to wait till it eats itself up. At least you're bringing him on the anti-pain side of life and chemistry. Right now, he's been eating and everything on the pain side of chemistry. I can tell you he wouldn't be in this. And he wouldn't have had the prostate problems. So now he has to learn you've got to drop what he might like, the proteins and all that, and visit our side for a while or enjoy the pain. And that's not a good pain in the male organ. So you've got to fix his prostate problem to fix this. And you have to go back, get the kidneys, you have to go back like we're talking on these videos, go back to my protocol video, or get in here and get on the 14-week protocol. But your husband has to belly up and get 100% raw and get past this. Or you can't get past this. So you got to convince your man that he's got to eat a diet like a primate, like a monkey diet for a while. His better, or better yet, a human diet, which is fruits. We're frugivores. His bladder was very sore. Oh, I bet. His bladder was very sore and red when he saw it on the screen a couple of years ago for urine retention. He's swollen down there, honey. It's all swollen and acidic. And the only result of that is decay and deterioration. They use the word cancer for that. But it's the end process of acidosis is deterioration and decay of tissue. You're done. So you have to he's got to back himself up and fix that. And the kidneys and adrenals are the main focus. And I'd clean up the bowels. I'd go into a systemic detox. Because you look like his bladder's on its way out too. You know, and you got to be careful there to decay the bladder. I mean, there's serious stuff here. You know, when you get into these levels, Sue, it's serious stuff, and your man needs to belly up and head on down the road of detox like all these other beautiful people are doing on great fasts and diets and stuff like that. They're taking care of themselves. They're pulling themselves out of these deeper areas of hellville of acidosis. Mm-hmm. He does not have retention now, but the penis is sore, especially when he passes water. We were told his bladder is enlarged. So hypertrophy. Hypertrophy is enlargement. What makes things swell and enlarged? Edema, water, acidosis, dehydration. So when you hydrate with base dominant foods, alkaline dominant foods, swelling goes down. Especially when you get what filtering? Kidneys, the lymph system. When you get the sewer system moving, the acids start coming out, all the swelling and everything goes down. But not if you're eating an acid-forming diet, because you haven't got the kidneys to work with an acid forming. You keep hitting the body with acids. See, so we got to change that. Heal All tea would be a perfect tea for him to drink. And I'd be drinking that, I'd be sipping on that all day long. So yeah, absolutely, be a good tea to drink, but you, a lot more than the tea. You want to get up there, you got to fix this man. You can't just drink a little bit of herbal tea and going to fix probably a prostate cancer case here. I mean, I had people do that. I can't believe that. I had an herbalist once, and she had a basal cell, went to a squamous cell in her face. She somehow read about our Heal All tea. She did, what'd she say, 5 cups a day for 2 months and no more cancer left. I just did the tea, but I don't recommend it. Head off and get his body fixed up.